Some people feel that moving to Medicare for all would be too disruptive. Nearly half of Americans get their health care through jobs. Many are happy with that and are reluctant to give it up for something administered by the government. But many people with employer-provided health insurance are actually underinsured because of high deductibles and copays. They think they have good insurance until they need it. Then they may find that they can't afford to pay those upfront cost-sharing charges, so they don't get the care they need. Or they get the care because they don't have any choice, and then find themselves in debt, even filing for bankruptcy because of medical bills. That sounds pretty disruptive. Maybe you are lucky enough to have a policy with a low premium and affordable cost sharing. But for most people, these costs continue to rise. As insurers try to control their costs, they funnel people into narrower and narrower networks. Many find that they can no longer see the doctors with whom they built great relationships, or go to the hospital where they feel most comfortable. If you are diagnosed with a new illness, you may find that the best doctor and hospital are not on your plan. More and more Americans are going bare, joining the millions who are underinsured because they can no longer afford basic family protection. How's that for disruptive? Expanding Medicare to cover everyone would eliminate all of these disruptions. The agency is already here. We wouldn't have to create a new one. And the size of government would actually shrink as we could eliminate many other health agencies, like Medicaid and CHIP, the Children's Health Insurance Program, and the medical component of all 50 state workmen's compensation programs, and others. You would have free choice of doctors and hospitals. You would have no deductibles or copays. People would not have to choose between paying the rent or getting medical care. Seniors would no longer have to figure out Medigap policies, as there would no longer be any gap to cover. You would not have to face the disruption of losing your family's health insurance if you change jobs or get laid off. You would fill out one enrollment form and never again have to think about switching plans, as Americans on average do 10 times during their lives. You may not be able to keep your present restrictive plan, but why would you want to? Rather than being disruptive, expanding Medicare would be one of the most calming, orderly things we could ever do. Just imagine the peace of mind it would bring to so many millions of us. Who would be disrupted? Private insurance companies, for sure. Drug companies would make smaller profits. But employers would no longer have to negotiate and pay for their employees' health insurance. American businesses could compete better internationally. There are many things that for-profit, private, free market companies can do better than governments. Healthcare is not one of them, as experience around the world and here at home has proved. Every other industrialized country has acknowledged that and done something about it. They spend half what we do, and their citizens are much healthier. We can't keep our heads in the sand much longer, as doing nothing is very disruptive.